You're listening to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for returning. Speaking of returning, we're going to be speaking with returning guest Dr. Larry Edwards. Dr. Edwards is chairman of the Gout Education Society, and he's coming back to talk about managing gout during the summer. Even though gout is a year-long, lifelong disease, there are certain times of the year, like summer, where there are some special considerations. Welcome back, Larry. How have you been?
I've been great, Neil. Thanks for having me back again.
Well, for those who may not be familiar with you, you are a regular contributor. Give us a little bit of your professional background, if you would.
Sure. I'm a professor of medicine at the University of Florida. I'm a rheumatologist. I've been studying gout and other rheumatic diseases for the past 40 years. But my emphasis has been on gout. And I'm the chairman, as you said, of the Gout Education Society, which is a nonprofit organization that tries to spread good information about gout. Not all things that you read on the internet are either worthwhile or even true. So we try and get a good sampling out there.
Who's affected by gout? I had a friend of mine describe gout as having kidney stones in his big toe.
Well, that's a pretty good description. It is considered by people who have it as the worst pain they've ever had in their life. Even those that have had kidney stones tell me that they would rather have the recurrence of their kidney stones than the actual arthritis of gout. Gout's an inflammatory arthritis that can affect almost anybody, but it's predominantly seen in men, certainly in the younger years. Men have the onset of their disease in their 40s and 50s usually. Women also get gout, but it's usually after menopause, so they don't see it until their late 60s or 70s typically. It is a familial disease, a pretty strong genetic underpinning to it, so that certainly is a risk factor.
Now, there are some misconceptions about gout being solely a lifestyle type of disease.
Yeah, that's right. We always have talked about it as being the disease of kings, and overindulgence in food and drink was the root of all of this. It's the kind of comedic representation of a very serious and painful disease. But in fact, most of the attribution of the causes of gout, now we understand, are genetic. Certainly, the presence also of obesity puts you at greater risk for having an elevated serum uric acid level, which is, of course, the biochemical underpinning of gout is to have a high serum uric acid level. So as far as food goes, it's not people that have sat around and drank a lot of wine or eaten a lot of red meat or shellfish. Those substances can possibly flare the disease, but the actual cause of the disease is mostly genetic. And then if you have some other comorbid diseases such as obesity or diabetes or kidney disease, then you're at greater risk for developing it.
What is it about gout that causes these different considerations during the summer months? I mean, it is a chronic disease, lifelong, year-long, but what is it about summer?
The disease itself is still going on, whether you're having the very painful gout flares or not. What we're talking about with the summer months risks are really things that can stimulate those flares from occurring. And when we think of summer, we think of sun and food and travel, and all three of those can really set you up for some problems. As far as the sun, people with gout really have to watch out for dehydration. Anytime you're going to spend a significant amount of time outdoors during the summer months when it's hot, you need to replenish your fluid supply and make sure that you're drinking plenty of water. People that get dehydrated are at greater risk for flares. So every day that you're outside, you should really and truly focus on taking in extra water. Food, it's a great time of the year for barbecues and putting some hamburgers or steaks on the grill, or maybe even some shrimp. All three of those things are kind of notorious for causing flares. So you have to do it in moderation. And the same thing for beer. Summertime is a great time for drinking beer, and I enjoy that. And people with gout can enjoy all of these things as long as they do it in moderation.
What about some of the medications?
Well, that's the important thing about travel in the summertime, is that if you're leaving home, don't forget your medications. Certainly if you're diabetic or if you have hypertension or elevated lipids and heart disease, you need to take all of those medications, but you need to be very mindful that you need to take your gout medications along with you. There's two types of gout medications that we talk about, Neil. One is the uric acid lowering drugs like allopurinol and febuxostat, and they are the kind of background medications that get the patient's uric acid down into a range that they stop having flares. But if you're still in that range of having flares, then you have some anti-inflammatory medication that you go to when the flares start up, and whether that's non-steroidal anti-inflammatory drugs or prednisone or colchicine, you have to remember to take those with you and not be caught away from home or without the medications that are going to help you.
And being the summer months, we're talking about some pretty high temperatures. Should there be some considerations about transporting these medicines on the beach or at that cookout? Right.
Prolonged periods of time of high temperatures, for instance, I wouldn't leave them in your car. If you have to walk away from it, leaving it in the trunk is a better place. It stays cooler than in the car, just because you don't have the light coming in through the windows and warming it up like an oven. But yeah, keeping them with you. If it's a temperature, just in the 90s and you're out on the beach, the drugs will hold up to that for some period of time. At 130 degrees inside your car, they're going to lose potency pretty quickly.
So as far as some resources on how to better manage our gout during the summer months, where can we go online and get some of that information?
Sure. At our website for the Gout Education Society at gouteducation.org, we'll have a little special just for this time of the year. As the winter holidays roll around, we always have a little special for that period of time too about moderating your appetites. But this would be the time to go to our website and not only look at what's needed in the summertime, but also for the optimal management of your gout. We have lots of helpful hints as well as some videos on there by gout experts about the best way to treat the flares and to take your uric acid medications.
Always a pleasure speaking with you, Dr. Edwards. Thank you for joining us again, and I'm looking forward to our next conversation.
Okay, Neil, thank you very much.
Great. You've been listening to Health Professional Radio. I'm your host in conversation with Dr. Larry Edwards, returning to talk with us about managing gout during the summer. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.